Hi, everybody, and welcome to the 15th episode of our broadcast, the Brain Function series from the Togetherness Media, Los Angeles. This is Mohammad Nami. I'm a medical cognitive neuroscientist and sleep disorders fellow. Currently, I'm at Shiraz University of Medical Sciences, and I'm also working with the Society for Brain Mapping and Therapeutics. This is a privilege for me, and I'm so pleased to have the opportunity again discussing with you something around this miraculous brain and what happened when the things in the brain function goes awry and we have a range of neurological, cognitive, behavioral, or psychiatric problems. So that's the importance of the thing, that we need to raise the awareness at a public level. We need to just pass on the torch together, and that's why we're having these discussions. So if you recall from the earlier season and also the last session, we've been discussing about so much different and wide varied range of topics. In last session, for example, we discussed about insomnia, which is one of the main and most important issues with the sleep of the people, especially in the COVID era. And today, we decided just to keep on talking about some sleep-related problem, if you like, and that is PLMD, which stands for periodic leg movement disorder during sleep. So it turns out that like 25% of the people that they have RLS or Restless Legs syndrome, that you're pretty much familiar with that perhaps. You see people that they are, for example, they are sitting in a doctor's office or the airport hall or I don't know where, but they just keep moving their legs like that. We also have happened to do this sometimes, but does it mean that we have RLS? Not necessarily, because sometimes we just feel like moving our legs in that way. So because making these oscillations makes some entrainment and some harmony between our brain oscillations of brain waves and the frequency of the shaking frequency of the movement that we're doing. Sometimes it's pleasant and we're doing this. It's nice, but when the people have this as a habit, not only a habit, but something more than it. And they wouldn't get relieved unless they keep moving the legs. They would be stressed out. They would be anxious if they cannot move their legs. They have this unpleasant crawling sensation beneath their skin, below, underneath their skins in their legs. And they have this tingling sensation. They have this burning or, like dysesthesia or bad feeling in their legs, and they cannot get relief unless they keep moving it. Then they would have probably will be diagnosed with RLS. And as I stated before, like 25% to 50% of the people that they have RLS, they come up with our PLMD symptoms, periodic leg movement disorder during sleep. And this PLMD is something important because the people wouldn't understand that this has happened. They don't have awareness about this. They just come in to the doctors of the sleep clinic, and they are complaining about inefficient sleep. And then when we do the polysomnography or sleep test, it would apparently be showing that, well, they have this like 20 to 40 second periodic movements of the lower limbs, and they have like jerky or ballistic movement of the lower limbs, or they have this twitching or cramping of the lower limb muscles. So they keep shaking or twitching their legs during sleep in a periodic fashion. And that's why the brain get aroused. They wouldn't go through different stages and different cycles of sleep. And by that, they wouldn't have the efficacy of a sleep. So during the day, they complain about bodily pain or fatigue or somnolence or excessive sleepiness during the day. Yeah. And in the people with periodic leg movement disorder, and the legs or arms or both would probably twitch and jerk, which is literally disrupting their sleep. But as I said, people are not usually aware of the movement. And the people with restless leg syndrome, on the other hand, they have trouble relaxing and sleeping because they feel an irresistible urge to move their legs or arms. So most of the cases, doctors may diagnose the RLS based on the clinical symptoms, and the diagnosis is like based on the history taking and clinical examination. But for PLMD, we got to be doing the sleep test, as we said before. And when the diagnosis of PLMD is confirmed, we shall not be looking for like a miraculous treatment, like a cure, so to speak. We should be looking for some ways, using the drugs or some kind of, remedies that they are commonly also used for Parkinson disease and other drugs that they can help control the symptoms. They are used to control the disease for a long period of time, and people will have quality sleep in that way. So the people also need to be aware of the risk factors that those factors would put them at a higher risk for RLS as well as PLMD. For instance, a sedentary lifestyle or smoking or obesity. These are the things that put the people at high risk. And on the other hand, the people who have PLMD, they report some concurrent and comorbid sleep problems such as narcolepsy or rapid eye movement, sleep behavioral disorders. Some of them may come up with issues with like, they will say that, doctor, I've been taking these medications like benzodiazepine, for instance, I've been taking diazepam or clonazepam. I was doing quite fine, but a doctor told me that I got to stop them. So the moment that I stop them, I start having this restless leg feeling in my legs, especially during sleep. So these people, when they cessate using those drugs, start to have PLMD. Also, the people who are concurrently taking some stimulants, for example, they are taking too much caffeine, or they are taking stimulant drugs or certain antidepressants, they would also have PLMD in many instances. Many patients with iron deficiency, many people with anemia, those who are pregnant, and those who have severe chronic kidney or liver disease, and the patients with a range of neurological disorders such as multiple sclerosis or Parkinson disease, they also come up with some symptoms of PLMD and RLS in some instances. And we need to first make sure that this is like the thing which is compatible with the diagnosis. We need to roll out the other concomitant problems or comorbid conditions, and based on that, we need to go for diagnosis based on the polysomnography. As I said, for RLS, the doctor's evaluation is the key thing, but for PLMD, we got to be doing polysomnography. For both of the disorders, doctors may need to do some more tests to diagnose the concurrent problems, for example, iron deficiency or problem with the magnesium or calcium level. And based on that, they would be prescribing, some medications, or they would just advise for some changes in your diet habits. They might be prescribing some medications that they are commonly used for Parkinson's disease, but we shouldn't be worried about it because we have some, interchangeable efficacy of the medications in different disease conditions. You'll probably be advised to avoid caffeine because that would make the symptoms worse. And also, if you have had the iron deficiency or problem with the other electrolytes, or some derangements in the serum, and the kind of supplements may be prescribed by the doctor. And also, we might be doing a bit of exercise activities that they're relaxing, like mindfulness-based practices or meditation or yoga and stuff like that. And the doctors sometimes they typically prescribe the drugs that they're including like pramipexole or ropinirole or rotigotine. So these are the common medications that they are being used for their treatment of RLS and PLMD specifically. In some cases, doctors might prescribe anti-seizure drugs. So don't panic. These are the drugs that they are, at the same time, kind of efficacious for other conditions, namely PLMD. Although they are anti-seizure drugs, but they are being used for another indication. When under the worst scenario, when doctors are just trying everything and it does not work, they might be using the opioids such as oxycodone. But because they have the dependence potential and there's a risk for addiction for these drugs, doctors are pretty cautious of prescribing opioids, and they're just leaving that as a last resort. And I hope that you just stay safe and well, and you have a good state of mental health, your bodily health, your neurological aptitude and health. And if you have any questions or comments regarding this video or the other sessions, that would be awesome to hear about it. So feel free to send messages to Togetherness Media, and we'll be there for you.